Good afternoon, everybody. I'm Lori Will. This is Dr. Darren Van Scoy. We're with Ascend Elite Health here to do our live question and answer today. So if you have any questions, be sure and send them in, and we'll get to them as soon as we can.
Absolutely. We're good with that first one.
Okay. My doctor tried me on T3, and I didn't tolerate it well. I was low, though. So what happened? This is from Jennifer. Now, to refresh here, this T3 means a thyroid hormone. T3 is the active form of thyroid. Most people, to be honest with you, get put on T4 or Synthroid. T3 is Cytomel or Leotheranine. T4 is the active form. And sometimes I've seen through people, number one, what dose were you started on, Jennifer? We're not quite sure of that. Sometimes if you start a patient on a little higher dose, they can be intolerant because it's the active form and they can respond with some anxiety or some maybe palpitations. So in our practice, we try to start people on a lower dose if we can. Now, that being said, most of the time I've noticed this is when someone has a higher thyroid stimulating hormone or TSH. It seems like when they're higher, which means we need some work on the thyroid, it's trying to make the thyroid put out more hormone. That seems to be the person that has more of a reactionary.
Since they're more sensitive.
Yeah, they're more sensitive with the
higher TSH for sure.
So yeah, that can happen. But with it, you didn't tolerate well. That's probably why the dose may have been incorrect or inappropriate for you at first. And sometimes we incrementally bring that up every 2 weeks. Sometimes we'll start someone on one tablet and say, if you feel okay in 7 days, go ahead and increase that, then get your labs in 2 weeks. It's just something that has to be monitored.
T3 is a very active. It's got a very short half-life, so it does act quickly. A lot of times too, physicians will start you out on, too high a dosage. Sometimes they'll start you, I've seen patients be started on 15, 25 micrograms of T3 and they get palpitations and those types of things. But yet if they started at 2.5 micrograms or 5 micrograms and over a period of 30 to 45 days work their way up to 15 to 25 micrograms, they tolerate it perfectly well. So it could have been too that they just started you out too high, but not knowing the background of where your numbers were. The other thing too is if you didn't have T4, if your T4 levels were low, T4 is kind of your reserve. So because T3 is highly active, we go through it very quickly. And then once you go through that, then T4 is your reserve that your body pulls from. So if your T4 level was also high, perhaps maybe, and that was a low T3, it could have been that the T4 reserve was acting and converting too quickly and turning into T3 along with the T3 that you were prescribed.
And you had a little too much.
Yeah, and you had a little bit too much. So again, more than likely, it was probably just the dosage was too high to start with. So I'd recommend kind of going back to your physician, talking to them about that, and maybe trying a much lower dose, 2.5 micrograms to 5 micrograms as initial dosage, and then kind of go from there and see how well you proceed with that. But more than likely, I'd say it was something very simple, not a big deal. But go back with them and discuss it, or feel free to give us a call at any time. Yeah, absolutely. Next question we got in. I saw your post on gut health affecting my hormone levels. How is that from Micah? I'll take that one real quickly. The gut health is huge. So a lot of the chemical processes and transfer processes that occur with our hormones occur in our gut and with the liver. So if we've got a gut that's inflamed, or we've got a gut that's got decreased permeability or too much permeability because of microbes and pathogens, a lot of times those transfers of those chemical hormones and then the transferring over into other sites, again, like T4 into T3, or from testosterone into free testosterone, occurs in the gut. So if the gut's inflamed, or if we have a gut that does not have good health, that does not digesting well, it impedes or slows down the transfer or the changeover of those chemical processes in our gut. So then the receptor sites don't get those hormones like they should. So gut health is extremely important. Digestion, digestive enzymes, making sure food is fully digested, going into the gut, into the upper abdomen, into the small bowel, into the large intestine. That's where a lot of the digestion occurs. But then also those chemicals and those nutrients leach out from the gut into the system at that point. And so if we've got inflammation, if we've got bacteria there that are impeding that process, it's going to slow down that usage of our hormones as well too, because of the inflammation that's present. So really, we recommend, everybody coming in, going in to see a physician that's well experienced with gut health, looking at different probiotics depending on what you have going on. There are definitely some probiotics that do well with different types of hormonal levels, right? And so that's the thing. Knowledge is really key with that, and knowing, okay, what's going on, what are you having problems with, and then looking at those different hormonal levels. The other thing is getting a gut test done, a GI mapping test, which we actually use a stool sample to see what kind of bacteria are present in the gut, both good and bad. and to see what ones we need to address, what ones we need to drop certain levels down, and what levels we need to bring up in regards to the good bacteria. But it's absolutely fundamental that, the gut is very healthy, because that gut health is where all of our processes occur. The liver and the gut is where most of our chemical processes and hormonal mediation, hormonal management occur. So it's definitely one of those things that should be top of line priority for both digestive enzymes and probiotics for most individuals.
He answered that absolutely. I don't need to add anything to that. That's his forte. He's very good with gut. So I'm letting him just continue on. Okay, the next question we have is, I've lost weight, but yet my body fat percentage has increased. How is that? How does that happen? That's from Mark.
Mark, it's a good question. Yeah.
Yeah, it's, basically when you're losing weight, from my experience, I can use this because that's how I met Darren. I was going to do a bodybuilding show and I was eating less. I was in prep for a bodybuilding show. I was eating what I was supposed to be eating, but yet I wasn't taking enough calories in versus what I was doing to lose as far as exercise as well. So what happens when that occurs is you're not just going to burn body fat percentage, you're going to burn muscle. You're going to have,
Huge.
you're going to have a water imbalance in your body. So these things are going to cause that fat, you're going to lose muscle mass.
Yeah. Yeah.
And that's
if your calories
sometimes
are too low, it
calories are
happens
too
all the
low,
time.
that can happen. So, and
Yeah.
that's what people make the mistake of doing, is they automatically want to starve themselves or cut their calories way down. And when in all actuality, it actually puts you at a standstill or puts you in a
Oh,
situation where you're
completely.
losing
Yeah.
muscle
We
mass.
see it all the time. Patients coming in at calories way below maintenance level. And they're really confused because they're not eating very much at all. And if anything, they're still gaining weight.
Correct.
And so, that's the problem. And so, because they basically shut their metabolism off, it's basically in a survival mode, only doing what it has to. This is probably a question more of, though, that I'd say the calories are too low, doing too much activity. More than likely, even though you've dropped your calories, even though you're dieting correctly, you're burning muscle mass. So you don't have enough protein and fat to support hormone levels and to support your muscle structure. So you're actually burning muscle mass for fuel. So the less muscle mass you have means you have a higher body fat percentage, because you've got less lean mass that you're dealing with. And so anytime we decrease our lean mass, we're going to be increasing our fat mass, right? If one comes up, the other one goes down. And so that's kind of what you're looking at. So more than likely, Mark, I would say that, even though you've lost weight, you've lost muscle mass. You've not lost body fat. So you really need to go back, look at your macros, make sure you're eating sufficient protein, sufficient fat to maintain hormonal levels.
Absolutely.
Carbs are just for fuel, right? We don't have to have carbs per se. They're just for fuel. But the two most important things there are going to definitely, absolutely 100% be your fat level and the amount of fat calories and your amount of protein calories, for sure.
Absolutely. Let's see what's next.
Carrie, I think
Yeah.
Carrie said, you posted that women lose muscle mass after age 40. Can you explain more, and how do I counteract that? You want to jump on that one?
Yeah, a lot of times when we're looking at women, we're looking at menopause time, and over that during menopause, we can lose about 20%. We can lose 20% of our muscle mass.
Yeah.
Estrogen levels are down. You've got this whole natural process of our hormonal levels being dropped, and you're going to lose fat. It's just we lose, what is it, 3% every year?
Yeah, women lose 3% after the age of
3%.
40. They
After
lose
age of 40,
3% every
every year.
year without intervention, i.e. resistance training. So that means from
Correct.
over a 10-year period, from 40 to 50, you're going to lose 30% of your
30%.
muscle mass. Then if you don't do anything about that, so you're already at 70% of what you started at. Then from 50 to 60, you're going to lose it. Then you're down another 30%. So you're at 40% of your muscle mass over a 20-year period. Massive decline in functional ability there.
Absolutely. I had a client yesterday on Saturday at the gym, taking her for a free walkthrough, and she's 61. I'm 60. She's like, "Oh my gosh, your muscles in your arms. Look at my arms." And she's never lifted a weight in her life. I said, "I know it's late, but it's never too late. You can
Absolutely.
help improve that muscle mass." So just because you're at that level, ladies, doesn't mean you cannot lift up a weight and start some resistance
Yeah,
training.
it
because
doesn't
it's
matter what
crucial.
age you are. It is never too late to start
Absolutely.
resistance training, but it's absolutely imperative 3 to 4 days a week, women. Now, men, we're in the same boat, but it's 2.75% per year versus 3%. So we have, 0.25% decrease in it, but it's still the same thing for men, right? You see all kinds of
Correct.
old guys that are 80 years old, walk around on a cane, can't get up out of their
Can't get
chair
up out of the
themselves.
chair.
If you want to be the 85-year-old grandparent who's mowing their own yard, driving around, muscle
Absolutely.
mass is an organ, right?
Mhm.
We know that absolutely their studies show that the increase in muscle mass correlates to a decrease in all-cause mortality. So the more muscle you have, to an extent, we're not talking about
Yeah.
freaks, bodybuilders that are over the top,
Exactly.
but the more muscle mass you have a decrease in all-cause mortality. Muscle is huge in the overall levels of health. So, it's one of those things, don't take it for granted. And whatever you do, don't think that, hey, because I'm 65 or 70, I can't start resistance training. It's never too late, and you can always undo some of that damage that's
Absolutely.
been done. And so the more muscle you have, the more functional you're going to be, the healthier you're going to be. You're going to be able to do more. So, I mean, overall level, the more muscle you have, the better off you are. So that's why it's so important that, resistance training 3 to 4 days a week. It doesn't have to be anything stupid heavy.
No.
Just something that you can do 8 to 12 reps, 3 or 4 sets with, that gives you a little bit of a burn. You're going to preserve muscle mass and even increase it a little bit. So we're not talking about hours and hours at the gym every day. 30 to 40 minutes resistance
Mhm.
training is going to preserve that muscle mass. Huge impact over a 10-year period.
Had a client last week. That was the reason she came to see us. She says, my mother cannot get out of a chair, and I
Yeah.
do not want to be my mother.
And
So
she was really
it's
worried about it.
really, really worried about it. And she's at that place she's in the menopause area. And she says, I'm not going to be my mom. So just take that to heart, ladies and gentlemen, actually.
Absolutely. Yeah. So next question, kind of related to it, from
Cool.
Betty. You have posted several times that you're preferential to weight training for both men and women over cardio exercise, and why? One, the muscle mass. Two, the other thing is really, by far, you'll see people all the time what we call skinny fat, right?
Yeah.
And these are these people that are just cardio. They still have high levels of body fat, because what happens is after a period of time, you completely adapt to that level of cardio, and you're just coasting. Like, your body's not burning fat. You're not burning a tremendous amount of calories, because the body's so used to that activity that you're not really doing much in regards to increasing your metabolism. The only way that you can increase the output or burn of mitochondria and like your caloric burn with cardio is to increase the time. So that once you adapt to a certain level, you've got to go further. You've got to go longer. You've got to go
Mhm.
harder. As opposed to weight training, once you adapt to, say, 3 sets of 5 at a certain weight, you just go to a heavier weight,
Heavier
right?
weight.
You don't have to lift longer. You don't have to do anything differently. You're just lifting. You're just
Mhm.
lifting heavier weight. So it's a lot more efficient way of exercise. Plus, then again, you're exercising that muscle mass, which is huge when we look at longevity and overall levels of health. Where you're actually utilizing that muscle, you're making it work, you're making it burn. So that's the problem with cardio. Cardio is good. We've got some patients that do better in regards to fat burning with cardio. But
Cardio.
overall level, most people will burn more fat with resistance training over a prolonged period of time than what they do with cardio, because of the adaptation principle and the fact that after you've done cardio for a certain period of time, your body's just completely adjusted to it, and you're not really doing anything as far as
No.
burning calories, increasing your cardiothoracic output, increasing your heart muscle function, those types of things. So that's why I'm preferential to it. And then just with training, a lot of times too, I get burnt out. A lot of people just get burnt out doing cardio.
Yeah, they
Cardio
do.
gets old.
It's and walking at a moderate pace where you're a little bit out of breath is a good thing to do.
Super
And that's
healthy.
good for cardiovascular reasons. But literally, like as the previous question and our discussion involved, you just definitely need to be doing some type of resistance training.
No matter how old you are, no matter what your level is, no matter level of fitness. If you've never started, I really encourage you to start today, start tomorrow, but get started with some type of resistance training. Absolutely crucial for overall level of health, for sure.
Next on the list, we have Isaac. My doctor started me on TRT, or testosterone replacement therapy, and my levels are going up, but I feel no different at all. Any suggestions? Okay, we don't have his levels, so we really can't go into that. Definitely, how long has he been on that injection? What was his level? What was his free testosterone level? Because that's a crucial portion, which was what we look at. Your testosterone might be 895, which is
Yeah.
great, but your free testosterone is low.
And a
So,
lot of doctors don't even look at
and
the
they don't
free
look at the free
testosterone,
test
and it's
level.
huge. Yeah.
And and basically, look at the estradiol levels. I mean, we want to make sure those are appropriate. There's other levels we look at.
Prolactin is
Prolactin. It
massive
might be
for men.
blocking the
Yeah.
fact that you can't.
Prolactin is huge for guys.
Absolutely. So there's, functional levels for us. We like to see guys. I mean, if they feel good at this place, 850 to 950.
Yep. And we have some
know,
guys that have to go a little bit higher because we look at their free testosterone
free
levels.
testosterone levels,
Yeah.
correct. And if they're sometimes they're there like, you know what, Darren, you know what, Lori, I'm almost where I think I should be. I just haven't reached that energy level yet. And we just bump them up incrementally. Again, like we do with women.
Slowly
It's
over a period of
slowly
time,
over
yeah.
a period of time. We monitor that because, just because more is not always better.
No, and actually more can be worse. For
More
sure.
can be worse. And we want you at a level with which you feel great. You're doing, there's no erectile dysfunction problems. Your libido's there, your energy levels there, you're recovering from workouts. All those things are really, really important. But the smaller the dose to get you there is what we're trying to do.
Well, and the other thing we see all the time too is we have, especially on the guy side of it, we have guys that don't respond well to creams.
Correct.
We have guys that don't respond well to certain types of esters for testosterone. So we've
Exactly.
got to switch. So there's a whole lot of variables here we don't have
Correct.
information for. So I mean,
Yeah,
really,
it
you've got to
takes
look
a-
at you've got to look at
yeah.
the type of testosterone. You've got to look at the formulation of the testosterone. Is it injection? Is it cream? Is it a troche, which is like a gummy you can put inside your mouth?
Mhm.
There's a lot of different things here, but we have some guys that just do not respond well to cypionate. So we have to look at other types of esters for them. So there's a lot of information to kind of go over here. But, the big thing is there's other hormones that could interfere. You got to look at estrogen. You got to look at prolactin.
Mhm.
We could have some liver issues.
Absolutely.
So that you're not converting the total testosterone into free, that's the important one.
Mhm.
A lot of docs don't even look at that. So you could have some liver issues that would be binding that up. So there's a lot to go over. It'd be one of those things I would suggest, if you're on testosterone and you're not seeing some results, give us a call. We'd love to have you come
We'd
in
love to
and
come in.
discuss that with you and see what's going on. Because again, it's really based on your free testosterone. We have some guys that are level 500, but yet their free test
Free
is
is
where it
good.
should be.
And that's their
And we
number.
keep them there, right? Because
That's
free
right.
is what we base everything on, free and how you feel. So it's one of those ones, if you're not responding well, there's a lot of issues there to address. Give us a call. I'd be glad to discuss that with you.
One other mention here too, I will say, is sometimes people that don't treat testosterone levels very often, or they've put you on an injection, sometimes they'll tell you to take a shot of 100 milligrams or every 2 weeks.
We see
Well,
that a
what
lot, yeah.
happens is you feel good for 3 or 4 days, and then you start going back down your level. It's like climbing the mountain and mountains and valleys, because you're not on a close enough dose together.
Yeah, ideally, we'd be injecting testosterone every day because that's how our body's normal circadian rhythm works. It's just, we keep
Be a very
levels
small
steady.
amount every single day.
But, we see doctors all the time prescribing injections
me.
once every 2 weeks. We get that in, and they do not do well, right? Because their
Exactly.
levels don't stay stable. And then that can increase estrogen levels, prolactin levels as well, too. So the more often that you pin in regards to testosterone replacement, if you're doing the injection, the better off you are by far, always. Microdosing is always like daily dosing would be the best way to pursue it. But who wants to give themselves a shot every day?
Right. And most of our people, they'll do it weekly or they'll do it biweekly.
Yeah, biweekly. And so most guys will do, if they don't do well once a week, they're okay with doing it twice a week, and it's easy, and they do very well with as far as keeping their levels stable, and they see better results. So it could be that you might even just need to go to twice a week pinning. So again, if it's one of those things, give us a call. We'd love to sit down and discuss it with you for sure.
Gotcha.
Let's see. My next one. My doctor said I need to get labs for my thyroid levels, but not to take my medication that day. Is that correct? Tara asks. Well, Tara, this is what I would say. If you're on thyroid medication, obviously your thyroid's not working correctly.
And it's a hormone.
It's
okay?
a hormone. Yeah,
So
it's a hormone. It's not even a medicine. It's
everybody
actually
else
a
calls it a
hormone.
medication. Yeah.
So if you don't take it on the day that you're being tested, how is your doctor supposed to know what your levels are, right? Because the
Right.
hormone's absent. It would be just like you not having that hormone at all and getting blood work to see what your levels are. It's absolutely a ridiculous idea to me that somebody would tell you you're going to be on hormones, and when we test your levels, we don't want you to be on those hormones to test those levels.
And you mentioned earlier, the half-life is very short.
And the half-life is
for
very
T3
short.
because it's the active form.
Yeah.
So you got to have it
I-
on board.
Yeah, I got to say that's a terrible idea. And we've actually had a couple of people ask us that. I've had some people call, say, hey, I'm on thyroid. I'm seeing another doctor. They told me not to do my blood work if I take my medicine that day. It's absolutely a ridiculous idea. Crazy. You have no idea, because T3 itself acts very shortly. It's, you take it every day for a reason. If it was longer than that, then you wouldn't have to take it every day. So if you don't take your medicine that day, that hormone that day, your levels are going to be lower. You're going to have no clue then how to adjust that hormonal level with the next visit.
With not taking it.
Yeah, with not taking it. So I got to say it's a terrible idea. So you might want to discuss that with your doctor. And if they don't want to discuss it with you, maybe find a new doctor on that one, because I don't think they know what they're doing. They really shouldn't be managing thyroid medication for you at that point. So that's just my point.
And he knows that thyroid is my favorite thing to manage. Literally, I love managing thyroid. So that was a simple question and a simple answer. So we went through with that.
That one was real easy. Yeah. So I'll let you take the next one.
Okay, let's see here. Okay. Monica says, I'm having a hard time losing weight, and a friend suggested I get some T3 or the active thyroid again and take it. Is this safe? Will it work? Well, now
you just opened up a can of worms.
You have
there,
a can of worms
yeah.
there. Definitely T3 is your thyroid, but you might not need T3. What if your T3 levels are good and you're putting yourself in a hyperthyroid state?
Which could be dangerous.
Can be dangerous. Can put you into a thyroid storm. You can have palpitations. You're going to have anxiety. You could have an arrhythmia of your heart. This is not something you just take lightly. And I will mention here, I'm from the bodybuilding world, and this happens all the time.
All the time. We see it. It's bane of my existence.
Yes. And literally, I've been honest with it. I did it on my show 3 years ago. And that's how I met Darren. I walk in his office. He's like, what are you doing First time he met me, you are wasting your muscle. And I was wasting muscle because I was on T3 and I was exercising, doing so much cardio a day and lifting weights. And I put myself in a situation where it could have been dangerous for
Yeah,
me.
absolutely. And it can be dangerous for anybody.
Anybody.
Yeah.
So, you know, from my own experience, I'm saying do not do that because it can cause your thyroid to stop functioning. And
Yes.
and which may be the reason mine isn't. Now I have a strong family history, mother, aunts, sister. But is that why mine was not functioning as well when I had to start my own Armour thyroid this year? So it's just not a good thing to do. You have to monitor those levels. It's going to make you lose weight, but unhealthily, and you can have bone loss,
Yeah,
muscle
and
loss.
T3 is not preferential. T3 can make you burn muscle just as much as it does fat. So that's
Absolutely.
the other issue you got to look at. And like Lori said too, one time taking, if you've got a normal functioning T3, right, normal functioning thyroid mechanism, T4 levels, T3 levels are good. You start taking T3 just to burn more fat. You could throw the entire that level is managed through the hypothalamus and the pituitary, right? Those are the monitoring organs, closely monitor everything. There's an axis there. It's a balance. It's a give and take. If you have normal functioning thyroid hormone, T3, T4, and you start taking T3 and you don't need to be, you can permanently damage that system one time. All it takes is one time. Now, do we see it very often? No, but it's still there. And I've actually seen it in some bodybuilders before because their trainer, which if you have a trainer that tells you you need to lose weight and wants to put you on, says you need to take T3, get a different trainer because they don't know what they're doing.
I have to agree.
Oh, I'll tell you that right now. If they suggest you need to take T3 to lose more fat,
Find
to do
your
this,
new trainer.
find a new trainer because they're just not good at what they're doing. But, you know, and so they decided to take T3 to help burn more fat. And then same thing. So from that point on, 3 years later, we're still having to manage their thyroid issues because they did that one time. It has never been right since. And it's been a struggle for that person the entire time. And so I can't even begin to exaggerate. I mean, just to really
It's crucial.
emphasize.
You don't need to take T3 unless you absolutely
do
need
not.
that.
It will burn fat, but it will burn muscle. And there's all kinds of side effects that you can have with it. It's one of those things that it is, you know, people think, oh, it's thyroid, it's a hormone, it's safe. It's not, it can be safe. Somebody like trained people that know what they're doing and managing it, absolutely it's safe. And it can be very wonderful people that need it. But if you don't need it, it can be really, really dangerous.
I'm laughing because very few primary care physicians will even put you on T3, even if you probably need it.
Yeah.
They only check your T4 and put you on Synthroid, which is T4. T4 has to convert to T3 to become active. So
Yes.
if you don't have enough, if it's not converting, you're not going to have enough T3. But it takes a trained individual to look at the laboratory data and look at that and figure it out and then put you on that medication. So you just don't want to mess with it. We cannot stress it enough.
Yeah, if you haven't had blood work that says you need thyroid hormone, do not take it, period, for any reason. And if anybody tells you to, find a different, whatever they're telling you for, tell them they don't know what they're talking about and run, period.
Absolutely.
Yeah, absolutely. So next one was, which is better, macros or calorie-based diet by Dan? And really, Dan, you know, I think this is a question that's going to be really kind of individualized. I think overall, what's nice about a macro-based diet, when we say macros, we're talking about proteins, fats, and carbohydrates, right? So if we give a person a macro-based diet, say they're supposed to have 200 grams of protein, 85 grams of fat, and let's say 120 grams of carbohydrates, right? As long as they hit those macros and we've got them set in a deficit, they're going to lose weight, right? Now, that doesn't mean that they can live on Twinkies and whatever else and lose weight. They'll still lose weight, but you're not going to be healthy, right?
Correct.
So within those macros, the cleaner that you eat within those macros, really, no matter what you eat, you're going to lose weight because those macros are set on a specific type of calorie-based diet, right? So it doesn't vary a whole lot from calories, but when you look at calories, that's just gross calories, right? So you could have all your calories come from sugars. You could have all your calories come from fat. You could have a majority of calories come from protein, but that doesn't mean that those ratios are healthy, right? And so that's the big difference in a macro-based diet versus a calorie-based diet. A macro-based diet is somebody that knows what they're doing is setting those macros to maintain your muscle mass during a deficit, to maintain your hormones during a deficit, and then yet just provide you enough energy to function so that you're still in a calorie deficit. You can still do what you want, but yet lose fat, right? Burn fat and lose weight. So that's kind of the big difference in a calorie diet versus a macro diet. We have some patients though that come in and say, listen, I don't want to have to think on my own. I want meal 1, meal 2, meal 3, meal 4. And that's a meal-based diet, right? That's extremely specific. Not for a lot of people because it's very rigid, doesn't have a lot of flexibility. But I think that most people, I think as far as our patients coming in, the macro-based diet that we figure out again, because the ratios are perfect, works better for most people.
And Darren's doing that for most everybody that comes in. And the first assessment, we can do that for you. But a lot of times we'll have you do a food diary when you come back
So we
into
have an
your
idea of where you're at,
where
yeah.
you're at, where you want to be, a food diary when you come back, and then he takes that and quickly puts it in, does his little equation and figures it out for the client.
Well, and
You know,
post flow work too, because a
yeah.
lot of
Plus
times
that way
if
we
you
look
have
at what's going
hormonal
on.
imbalances, well, we have patients coming in all the time with super low fat diets, men and
Yes,
women, and then all of a sudden
the
we do
hormones
their
are
blood
jacked.
work, and yeah, their hormones are completely jacked
Mhm.
because they don't have enough fat. Cholesterol is not a bad thing,
You
right?
got to have some fat to
You've
have
got to have
hormones.
cholesterol. You've got to have fat. Cholesterol is very important to our bodies, just like anything else. Too much of anything can be a bad thing.
Mhm.
So cholesterol is not your enemy, right? It's just too much cholesterol is a bad thing. But so cholesterol and fat is extremely important for managing our hormones. And if we're on a very low fat diet, your hormones are going to crash. Your
Mhm.
thyroid's going to crash. Your
Absolutely.
testosterone, your estrogen, your progesterone, everything that in regards to androgenic sex related hormones are going to crash because that cholesterol, and actually even brain function is going to decrease
Absolutely.
because of the low
Increase it.
fat diet. So that macros are really important in that because the ratios are extremely important. But again, we see that all the time post blood work. We have somebody, their hormones are in the tank, and then we start talking about their diet, and they're on this low
And
fat
they have
diet,
no fat.
no fat in their diet, like literally at
You
all.
got to
Yeah,
have some fat.
you've got to have some fat. It adds spice to life anyway. The fat's where the good flavor is anyhow. So that's one of those things. Don't be afraid of fat. Whatever you do, there are some
Just do some
conditions.
good, the good
Yeah,
sources.
yeah, good
Maintain
sources
good
of
sources.
fat. So when we're talking about good sources of fat, we're talking about olive oil, avocado oil,
Almonds,
almonds, walnuts,
walnuts.
yeah,
Yeah.
MCT, coconut oil, eggs, great source of
Great
fat,
source of
right?
fat.
Yeah, I mean, when you think you eat an egg, that's a little casing that grows an entire being, right?
That's right.
There's everything you need nutritionally in an egg. So eggs are not your enemy by any means. And so you can eat 3 or 4 eggs a day with really no negative impact on your cholesterol levels at all. So
Back to the caloric, it used to be everybody was like, oh, I'm on 1,000-calorie diet. I'm on a 1,200-calorie diet. And they'll tell you have to eat this many calories to maintain your weight. You've heard this for years and years
yes,
and years. And, I've been sick over the past week and I had no appetite. I wasn't able to work out. I've just kind of hydrated all the past week. Nothing tasted good. So a couple of times through the week, I've had some a chocolate, just to something to make me have some type of taste. I lost 3 pounds. My calories were low. But was that healthy what I ate? Absolutely not. And I can't maintain my life living like that. So I stick to a macro plan. That's what I
yeah,
have every day.
macros are going to be better because it's going to be the right ratios of the different macros for your proteins, your proteins, fats, and carbs. You're not going to get an overload of one, and it makes sure that way everything's
Mhm.
stable throughout the system. So again, I prefer macros. I think most people, when you look at the overall planning and the health fitness community, I'd say macro based diets by far the best
Absolutely.
option for most people for sure.
All right, we have another TRT question.
Yeah.
It looks like Jerry says, I started TRT, but my libido has not improved. Is there a problem with me, or do I just have to have a higher dose? Again, a little bit more information. Here's what we need. But let's say,
Well, Jerry, we're not sure if Jerry's a guy or a
I
girl
know,
either,
I know,
really.
I'm sure.
Unfortunately,
So
so
I'm going to look at it from the guy's
yeah.
standpoint, or anyone, basically guy, because as we've mentioned before, I'm from cardiovascular background. So for me, say Jerry is on TRT. Jerry's levels are 850 to 950. His free test is in a good place. His estradiol's in a good place. Everything's balanced out, looks great. He's still having some erectile dysfunction, maybe some low libido. If he had erectile dysfunction, I'm going to be really concerned. I'm going to think, what's going on here? Why is the blood flow to the penis not
Right.
happening? Is there some small occlusions in those arteries? Does he have some history of heart disease in his family? I'm going to look at it deeper. As far as libido goes, that's not going to kind of have the same context for me. We're just going to try to look and make sure that those levels are right. But again, we don't know where he is,
Yeah,
or
and
he or
libido is
she is
really
at
how
this
you
point.
look at. I mean, there's so many things that affect me. I mean, libido is the mental picture
Mental
of
picture.
intimacy, right? And so, if you're highly stressed, right? If you're not sleeping well, don't feel well. I mean, you could be on the perfect levels of testosterone, and libido could still be in the tank because it's the mental
The mental
aspect of it,
aspect.
right? And so and for women that's the
You
biggest
can't
thing,
get out of
right?
your head.
Women can't get out of their
Can't
head for
get
a lot
away
of
from those
things, right?
things.
And
Yeah.
so, and moms, working, kids, stress, all that,
Mhm.
and it's all of a sudden, so trying to get that libido up has nothing to do sometimes with hormones whatsoever. It's
Mhm.
actually life, right? It's
Absolutely.
managing stress. It's managing, the things that are getting, managing sleep, managing stress,
Mhm.
managing all those daily life things are basically taking away from that ability to look at libido and think about intimacy. So libido is kind of one of those things. It's a tricky thing because it can be physical. Absolutely. Because I mean, if the hormones aren't there, probably not going to have much libido, right? But even if the hormones are there, we see all the
Those
time,
things
we've
get in
got
the way.
patients coming in going, I understand my libido is not where I think it should be or where I want it to be. And for women, again, it's especially if you have kids, if they're working, it's just a whole different ball game. For
Just find
guys,
a
though,
time slot.
yeah, for guys, a lot of times though, I mean, libido isn't an issue. Guys, it's just there, right?
It's there no matter
But
what.
when we're talking about erectile issues, absolutely, like what Lori touched on there, is the fact that it absolutely could be a major medical issue if you've got erectile problems in regards to cardiovascular problem. And so that's something that definitely needs to be checked out. And we've seen that in the year and a half we've been in practice already.
Yeah,
I mean, guys that come in
several times.
literally for erectile problems end up having heart surgery.
Yeah.
We've seen that several times.
Yeah.
Yeah. And I mean, so it could be a major issue. So don't let that go by, guys. Like, don't be embarrassed by it. Get that checked. Yeah, absolutely. Get that checked. So, we don't know what Jerry's referring to in regards to libido per se. Is it erectile issue? Is it man, female? But if it's one of those things, guys, if you're having erectile problems, you absolutely need to get that checked out, because it may not be a hormone issue at all. It could be a cardiovascular problem.
Yeah. And if you don't feel comfortable talking to your doctor about that, please give us a call. Now, I'm going to mention, say this is Jerry and it's a female. Jerry, females, when we start testosterone, usually you can use injectables, but again, like Darren said, who wants to inject themselves every day?
Especially women. Typically
And that's
don't
that's definitely a micro dose for a woman.
Yeah.
You're not going to be on a high dose,
small dosage.
and you can hardly get that injection every day. I mean, that's such a small amount.
Yes.
But when I use a 3-source bioidentical cream. I use a vaginal suppository, and we use a troche. Of course, an injectable. If someone wanted that, if they needed that, we could go that route. Basically, Jerry, it's a time capsule here. We have to look at more than just that testosterone level. If that's what you're taking the testosterone, obviously. Sometimes it takes a little longer to get to the level it's supposed
Everybody's
to.
different physiologically.
Everybody's different. We have to look at the prohormone levels, the DHEA and the pregnenolone. I'll use myself as an example. I do that a lot because it helps women understand, but I've taken DHEA to help with my testosterone levels. I think it was last month. My hormones were absolutely on point. I thought, okay, I don't need to take this DHEA anymore. This is the second time I've taken myself off. I recheck it. I try, because I'm doing a test on how I put my cream on, if it's effective or not. I am back down low. So I just know, Laura, you cannot take the prohormone away, because
it seems like we're seeing that more with females.
Yes.
By far across the board. Women that are not on DHEA do not respond as well to the testosterone therapy or estrogen, progesterone as well.
I agree.
Without the DHEA, period, across the board. Guys, it doesn't. I mean, there's a little bit of play there, but women, it seems like it's really important. We're seeing that more and more.
Yeah, I think, and I started the pregnenolone because mine was a little low, but that's not kept me up. The DHEA is the key for me, and I'm seeing that with a lot of other women. So that might be the issue, Jerry. If you are female, you may have not been on the therapy long enough. You may need to look at other avenues like prohormones, what those levels are, to help boost that testosterone level up. Sometimes you'll have the honeymoon phase where you'll get on that cream, and for like 2 weeks, you're like, oh, let's go, honey, let's go.
Yeah.
And then it fades away because you've just got that surge in, and then you start leveling off.
The body likes to normalize, right? It likes to find a normal place that it can operate from, a steady, stable place. And so sometimes that'll happen. And then you just redo blood work. You look at, again, these substrate hormones again, may have to increase dosages. There's a lot that goes into it for sure. So, but great question. Actually, and we've kind of ran through most of them. So guys, we really appreciate your time. Thank you so much. As always, look us up, totalhealthpros.com. 304-382-2080 is my number. Lori's is 681-781-9005. Got it. Nailed it. So if you guys have any questions, please hit us up. We'd love to get together with you, do a consult, answer whatever questions you may have. Appreciate it, guys. Thanks so much.
Thanks so much. Bye.